There are two sets of surveys. One has to do with individuals. We want to know your skill sets. We want to know your interests. We want to know where you want to be engaged in. We want to know what activities you are already engaged in. And there's one for organizations. So like Claudette, who is the president of our nursing association. I've met Jamaicans who are president of bar associations. I've met presidents of diaspora foundations, presidents of civic organizations. We want to know who you are, where you are, what you are doing, and how you can become engaged. How can we engage you? How can you engage us? And this online survey is going to be a tool to allow us to do precisely that. So I'm encouraging everybody who is here to sign on, sign up, and become engaged in this process of nation building. Now, I am not using nation simply in the geographical sense, because when you talk about Jamaica, we're not talking about the 14 parishes in Jamaica, because Jamaicans are scattered far and wide. We're speaking about the Jamaican community everywhere and anywhere they are. And it's interesting. We need to study the history of Jamaica and Jamaicans. We would be amazed at what Jamaicans have done in this world. If you go into Costa Rica and you take a train there, Jamaicans built that railway. If you go into Panama and you transit the Panama Canal, Jamaicans built the Panama Canal. And if you come here in Canada, and you're going to the Ministry of Finance, Jamaicans are there. So I want to say to us that the strength of Jamaica rests in every single Jamaican, wherever they are. And when we talk about Jamaicans, we're talking about first, second, third, fourth, and their friends, and their spouses, even their enemies. Right? Because everybody wants to be called a Jamaican. And I want to say to us that we have a very rich legacy. And I believe that Jamaicans working together can transform the fortunes of all Jamaicans. And I don't want us to misunderstand. This is not simply about the Jamaicans that remain in Jamaica. Our interest is the progress, the development, and the full realization of the full potential of Jamaicans every single way. And we can contribute to that development once we are organized and we are engaged. And that is my word, that is my message. I think that is what this conference, this forum is about this afternoon. Organization and engagement. Because of that organization and engagement, a historic memorandum of understanding was signed between the Ministry of Health and the Sunnybrook Hospital that will see partnerships in healthcare in Jamaica that is going to improve healthcare in Jamaica. And I would dare say that will also improve healthcare in Canada. Because make no mistake about it, that Jamaica also has significant talent in certain areas of medicine that we can share with our international partners. And therefore it is a meaningful partnership that we have established, including the teaching hospital of the University of the West Indies, where we have some of the leading professionals in medicine emanating from whether they are nurses, physicians, or specialists. So I think that this is a very important step in deepening the partnership between Jamaica and the diaspora. And I want to take this opportunity to congratulate the organizers, Valerie Steele, Kingsley, and all the team around them who have made this possible. It is not easy. It is never easy. The Education Summit took 7 months to plan, and the work only started after the event. The work isn't over. It's part of the organization and the engagement. And similarly here, we are deepening the connection between the health professionals here in Canada and the health professionals in Jamaica. That is going to benefit not only Jamaicans in Jamaica, but also Jamaicans in the diaspora. And I'm sure it will benefit our Canadian friends as well, because that is how Jamaicans are. What we do doesn't only impact us, but it impacts our communities around us. So I'm not going to stay very long. I'm going to take my seat. As I take my seat, our buzzwords are organize and engage. Thank you.
Thank you very much, Minister Brown. It's always nice to hear you. Now, ladies and gentlemen, I made a football in terms of the program, and so we're going to backtrack a little bit because we're going to do some greetings, but Minister Hunter has to leave, so I'm going to ask to hear from her now.
Thank you so much, and all protocols being observed, I am so pleased to be here this evening and to address you. I want to say a special thank you for this invitation, and Mr. Gilliam, it is very difficult to say no to you, and I know that you did everything for me to be here today, and I also really want to acknowledge and thank the Consul General for his support, Mr. George Seth Ramakan, and he's just such a wonderful representative here. You know, every time I'm in a room of my people, I am so proud to be part of this community, and you know, I really wear that very, very proudly. I just came through an election. I actually came through 2 elections in less than a year. And on my bio and website and leaflet and interviews with the press, I always say that I'm a Jamaican. Yeah. And it's a very strong part of my identity and who I am. I'm joined here this evening by my executive assistant, Tiff Blair, and I'm here because I know how important this relationship is and how important this topic of health is. For us in Ontario, almost 50% of our budget is on healthcare. So it is a very critical part of the work that we do in Ontario. And I want to also just acknowledge, you know, in our legislature, in our Liberal caucus, there are 4 Caribbean members who are elected to represent the communities, but also the broader community, 2 of which are Jamaican. Mr. Ryan Anderson, the member from Durham, has just been elected. I believe he has taken a riding that had been the opposition for many years. I think it's like 70 years. It's a very long time. So we're very, very proud and are striving to represent you well. The work being done by the diaspora, I believe I was at the 2004 gathering. Whenever that gathering was held at Revival Time Tabernacle, I was there at the games, and I'm so proud to see how you've grown as an organization and the work that you're doing internationally, as well as on the island itself. I think it's remarkable, and the friends in the room today is a reflection of that. I know the ones that are from here are very busy people, and the fact that they've joined you tonight is a show of support for the work and for the outcome of that work. But I'm also very impressed by the international delegation. First of all, you're a good-looking delegation. I have to say that. But I also know that there are many other priorities in your worlds as well, and you're here. And I believe one of the things that I believe is never underestimate the power of a small group of people to change the world, because it is the only thing that has changed the world. And the work that you're undertaking over the next 3 days has the power to transform and to change lives and to make lives even better. So I think you have an incredible task ahead, but I am very, very confident that the people in this room can take that challenge on and make a real and material difference in people's lives. As an Ontario government, healthcare is very important. Our focus is putting patients first, but we're also really focused on responding to the needs of people where they are. And we are undertaking a transformation of our own. And what we're focused on is delivering the right healthcare at the right time in the right place. In fact, we are focusing on moving more care out into the community. And our investments are in community care, home care, personal support workers. We want to strengthen and professionalize those that are closest to the patient and to individuals. So that's something that we're undertaking, and we want to do this rapidly. For many reasons, we're very motivated to do that. So we're also looking to learn many, many lessons from you as well. So I really appreciate the Minister's focus on collaboration and on engagement, and we believe in that. Also, I know that Jamaica and Canada have a very long history of collaboration and engagement, and there are natural synergies between our two countries, and there is an open relationship, in fact, between our two countries. So I'm very pleased to welcome you all here, and that you've chosen this community to have your conference, and that Sunnybrook, I'm not surprised, is such a willing and able partner to host this conference this weekend. So I'm proud to stand with you here today on behalf of our Premier, Kathleen Wynne, and we have a new Minister of Health, Dr. Eric Hoskins, as well, and I know that the invitation is out to him. I will let him know that I was here and of your good work. So I wish you all the best over the next 3 days, and I look forward to hearing about the outcomes. Thank you.
Thanks, Minister Hunter. It's wonderful. Ladies and gentlemen, I think we should have a little bit of entertainment. We have a distinguished performer that will lighten up the room, but I don't know, she like a big stage, not for space. Is Miss Letna Allen available now? Is she ready?